We're here with our friend, Yo Murphy. He's a former pro athlete, and he's a partner at the Performance Compound, where they train professional athletes. And Yo got an Ozone and a PRP in his knee, so I'm here to follow up with Yo and ask him some questions.
Well, I had a torn quad tendon when I was playing football with the Rams in 2003. Didn't have any pain until I retired in 2009. It really started affecting me, just kind of pushed through it. So for, about 3 years, it's really been bothering me on and off, and, I just, was about to start looking for other solutions.
What other solutions were you considering?
I had gone back to a doctor that had not performed my surgery, but had given me some advice and told me I needed to get the surgery. He talked about doing a scope, going in, checking it out, cleaning it up. And that was basically it, just, some traditional medicine stuff.
What sort of was the catalyst for you to reach out to Dr. Rucker and try some alternative therapies like PRP and the ozone injection in your knee?
Well, about 2 months before, I'd had some shoulder issues from when I was playing football. Doc gave me an ozone shot on my shoulder, and I haven't had any problems since. I'd done some research on PRP before even meeting Dr. Rucker. After we had the conversation and he told me about it, and knowing what the ozone had done for my shoulder, I was all in. Anything to get rid of the pain, I would try, and I knew from the research that it wasn't going to put me any further back than where I was.
So you get the PRP done on your knee. When did you start to notice a difference?
He told me to stay off it for about 4 weeks, so I didn't do anything. I had a little bit of aches I felt from just the injection for the next 2 days. It felt great for the 4 weeks, but I wasn't doing anything, so I wasn't sure if that was just because I hadn't, really done much anything. I hadn't run, I hadn't worked out, just, normal everyday life in the weight room with the guys training. But that 5th week, I went pretty hard on it. Did sled push workout, sled pull, did some squats, stuff that I would normally do, maybe not quite the weight, but pretty intense. I had absolutely no pain on my knee. Next time I went through it, I added some weight, and a little bit more intensity. Had some pain in my knee, was kind of worried about it, but the pain went away, and I haven't had any problems ever since.
That's great. And is this a procedure that you'd recommend to both your friends and any athletes dealing with any sort of issues like you had?
Definitely. Definitely. I feel the biggest test, or the biggest, I guess the biggest test would be pain-free. The biggest, yeah, the thing that I want to do is get rid of the pain.
Absolutely.
The pain's 100% gone. When an athlete has pain, or a normal person has pain, it's your body telling you something's wrong. Body's not telling me that anymore. I feel great. My knee feels great. I always go through something before I recommend it to my athletes or any of my clients that I train or friends. And I went through it, and I feel great.
Thank you very much, Yo.
You got it.